My name is Dr. Willis Akware. I'm a senior advisor at the African Leaders Malaria Alliance. As you know, His Excellency President Uhuru Kenyatta is currently the chairman of African Leaders Malaria Alliance. And as his term comes to a close, he had 4 legacy agenda items. Among those agenda items was the formation of youth armies. And the purpose of forming the youth armies was to involve the young people on the African continent on addressing this socio-economic challenge of malaria burden. He saw the need to include the youth in the areas of advocacy where decisions are made, not only at the national level, but also global level, continental level, but also include them in the actual malaria activities at the grassroots level, because the future is theirs. And in forming the army, he said, we will get a lot of dividend by utilizing the energies of the young people on the continent. So for me in Kenya, that is why I'm working as a senior advisor. In July of 2021, His Excellency the President launched the Kenya Malaria Youth Army in Kilifi in Kenya, and challenged the army to ensure that they get as many young people involved in malaria control activities. What I must say is that it has been phenomenal in terms of progress and achievement. We've seen the numbers of people joining the army voluntarily across the entire country. We've seen the energies in terms of bringing new ideas, in terms of addressing some of the challenges that we do have on the continent. We've seen them being on the forefront in mobilizing communities for the uptake of malaria interventions, the bed nets, the indoor residue spraying, the education around preventive measures around malaria. The Kenya Malaria Youth Army has been very, very great in that. They have performed beyond our expectations.
My name is John Mwangi, a member of the Kenya Malaria Youth Army and also the team lead. I'm the chair of the Kenya Malaria Youth Advisory Council and also the lead for research and development. For the past 1 year, it's been a very awesome experience for us, starting with structuring the army, getting to know all the regions that we have, starting from the northeastern all the way coast to the western region, and bringing the members together for the past 1 year. I can say it's been not easy, especially coordinating the members, especially doing virtual meetings and all that. It's not every day that we get to meet each one of us, but we have been able to achieve a lot within the past 1 year. As you've seen, we did the World Malaria Day celebrations in Kakamega, which was a big success for us. We've been able to do a couple of activities starting from capacity building. We did one with DNMP, and that is a big step for us, and we are forging ahead.
So my name is Dorothy Nyongo, and I'm the County First Lady of Kisumu. I'm also a member of the End Malaria Council. Last year, exactly a year ago, I was in Kilifi when President Uhuru Kenyatta launched the Malaria Youth Army. And today, and since yesterday actually, I've seen the youth at work as they celebrate 1 year. We interacted with them. We went into the ground, into Busia, close to the Uganda border, and it was just so fascinating watching the drones doing the spraying of the larvae along the river. And that was really fascinating to see the young people involved, ready to fight malaria and to bring it to an end. We started off the day with the walk, the march through the city. The band was awesome. I really enjoyed it. And it was really just nice to see the placards passing on the malaria messages. And I believe that the youth are the army that we need to fight malaria by going into the communities, educating them, and reminding them to use the net and to prevent water from stagnating around their homes.
Today we started by officiating the preceding band where we had a malaria walk around Busia County town. Another activity that we came to the ground for, joining the laryngitis exercise by the EMC. The rest of the team is doing distribution of IEC materials and sensitizing the community on prevention measures for malaria.
Indeed, I would recommend going forward the End Malaria Council in Kenya, of which I am the secretary. We are having discussions of how we will continue engaging the Kenya Youth Army. A lot of proposals are coming. We are going to have a forum to discuss them, but we definitely see their involvement in the area of social behavior change communication as being very key, in the area of innovation, in the area of digitalization, and in the area of what you would call technological adoption towards prevention of malaria. So those are some of the areas we think the youth will do very well.
Besides being a Malaria Youth Army champion, also studying as a microbiologist. And the event that just happened here at the Busia County is one of the most successful events. In that, you see, most of the time we normally use chemicals, agrochemicals to control insects. But this time we've gone the biological way, which is not only safe but doesn't also mess the ecosystem. Like in that, it's also safe, doesn't have effects on both humans and or the animals around or anything else.
So the youth can understand the link between mosquitoes and malaria much more than even our parents and forefathers could because they are educated. And I believe even through the school systems, it's possible to educate them from a very young age so that they have practices that help to fight malaria. And together with government and of course the Malaria Control Board and the Council, all of us together, we can work to eliminate malaria.
So the activities today has really been one of those activities that will always remain in our minds. Anything innovative is solution, especially to the young people of today. So it has really been a great moment. We've had door-to-door sensitization. We have had we've seen them launch the deciding bit of it. We have had community engagement. We've had advocacy. We've had the Zero Malaria Walk, which we started all the way from the hospital to and around the town, just letting the community know that we need to eliminate malaria because it is killing people every single day.
As we speak, I'm in Busia County, one of the counties with the highest malaria transmission, with a prevalence rate of 39%. That means almost 40 out of 100 people will be having the parasites. So I'm happy because first we came to commemorate the 1 year of the formation of the Youth Army, and I'm happy to see that they are actually very active already. At 1 year, they have done a lot more. We also came for the induction of the youth on malaria control intervention facilitated by the Ministry of Health. The kind of questions were very encouraging. The kind of enthusiasm shown during the training was also very great. And finally, End Malaria Council now has started getting funders, and our purpose is to really go to where the big burden is. And that is why we chose Busia to deploy, with support from SC Johnson. We have now got funding to deploy the drone technology to kill mosquitoes at the breeding sites, especially areas that cannot be accessed for larviciding. And the technology definitely, as you can see, is going to make work much easier. It is going to cover a lot more areas. But we are saying that's not the only intervention. We are still going to have bed nets going on. We are still going to have our treatments. And we are still also going to do other larval source management. So I see in the next year or two, we should be here celebrating a major reduction in malaria burden in Busia.
I just want to thank the EMC and everyone at large who participated, the Malaria Youth Champion, and specifically to the EMC Chair, Mr. Chris Gitonga, for not only being the fight against malaria, but also he's also in the forefront in the fight against malaria. As you guys have seen, he was there with us, and that was also a plus.